First of its kind partnership will help reduce ER wait times at One Valley Hospital. Mountain Vista Medical Center and the Mesa Fire Department, they are teaming up to put a nurse practitioner and a paramedic in some of the ambulances. Here's an example. If a daughter calls 911 because her mom fell and broke something, it's not life-threatening. So the 911 dispatcher sends out the new team.
You're sending 4 highly trained professionals and you're taking them off the street so that if there's a real fire or a life thing, they're off doing something else.
So now to learn more about this new program are the folks in the trenches who work this, and we are joined by Tom Morris this morning with Mesa Fire and Medical Fire Paramedic. Tom, good morning. Why was this name change so important?
Well, Scott, this is a partnership between Mesa Fire and Medical Department and Mountain Vista Medical Center. And the idea is to provide a new service line for the patients of the city of Mesa and to provide a higher level of care and to take care of patients when they have medical problems that aren't necessarily very serious.
So does
and we just
go ahead.
Go ahead.
So does that mean you can cover twice as much ground?
Yeah, what happens is when they call 911, they dispatch a TRV or a smaller unit with my partner paramedic and myself, as opposed to a 4-person firefighter apparatus, and the fire apparatus can stay better positioned and respond to higher level calls such as strokes, heart attacks, and fires, and we take care of the more minor problems.
So would you say that you're seeing more non-life-threatening calls? Possibly that's why you changed the name?
Absolutely. About 85% of all calls that come into 911 for fire are medical in nature, and of those, a majority of them are fairly minor. And the idea is that we will dispatch the TRV unit with the nurse practitioner and the paramedic as opposed to the larger apparatus, and we'll be able to provide a better service, decompress the emergency departments, and be able to avoid transport to the emergency department.
And you are a nurse practitioner. That I don't, unless you've been in an ambulance or know somebody that has, I don't know if we realize the importance of the ride from wherever you pick the patient up to where you're going. I mean, you guys, what you do back there is really amazing. You save the day, basically.
Yeah, what we're trying to do is to take care of very minor problems in the field as opposed to transporting them to the emergency department. The patient will be treated in the back of the ambulance. They'll be prescribed antibiotics or maybe pain relievers for their ankle or their sore throat, and they'll be discharged at the scene, and they'll avoid an emergency visit altogether. By doing this, we'll be able to decompress the emergency department, and those patients who have very serious medical problems will be seen much more quickly and more efficiently.
And Tom, where did you guys get this idea? Just one last question.
This is a pilot program that went back a couple of years ago where they used physician's assistants in the Mesa Fire TRVs. It was shelved for a short period of time, and then as because of Mountain Vista Medical Center partnering with Mesa Fire, it was able to be restarted again, and we've already gone on a number of calls.
Yeah, I wouldn't be surprised if a lot of other cities follow suit. So Tom, thanks for your time, and good luck with the program.
Thank you.
Okay, good having you.